Hi, I'm Dr. Heather Malyuk. I am Head of Audiology for Tuned, and I'd like to speak with you briefly about getting tuned into hearing health. If you're wondering, what is Tuned? We were founded in 2020. We are a teleaudiology platform. We're the largest online audiology network in the United States. We are VC backed and so far have raised over $11 million. And we're currently serving over 100,000 members who represent over 160 companies. We are the hearing health benefit. We're focused on what we call the 4 pillars of hearing health, which are hearing loss prevention, hearing loss itself from mild to severe hearing loss, hearing disorders such as tinnitus and auditory processing disorder, and balance. This presentation today will briefly go over our 4 most frequently asked questions to give you an idea of what Tuned really does. It's difficult to know what to do in the hearing healthcare space or what it can offer you when you don't work in the space. And so for many people, audiology is a mystery. And so I'd like to answer 4 frequently asked questions to give you a better idea of what a tuned audiologist can do for you. Our first frequently asked question is, can Tuned help me with issues I'm having not related to hearing aids? The answer is yes. Many people, when they think of audiologists, think of individuals who fit hearing aids and treat hearing loss. And while that is true, audiologists can do so much more. Tuned focuses on comprehensive hearing care, which includes hearing disorder management. So I mentioned tinnitus earlier. Many people think of that as ringing in the ears, decreased sound tolerance, and auditory processing disorders. We also work with vestibular disorders. If you're not sure what vestibular means, it's your balance. So it could be dizziness, vertigo, or associated fatigue. The approach that Tuned takes really encompasses the entire auditory and vestibular spectrum so that anyone experiencing issues can receive care. Our second most frequently asked question is, I feel like I'm pretty good about protecting my hearing, but I've never spoken with an audiologist. Is it worth it? What would I learn that I can't learn online? Again, the answer is yes, absolutely. You should speak one-on-one with an audiologist about your experiences in sound. And what you would gain from speaking with a tuned audiologist is a personalized exposure profile. So, talking about your sound exposures and your needs and whether or not you're even at risk. Expert interpretation of early symptoms you may be experiencing related to sound exposure. And then preventive strategies tailored to your lifestyle and your work environment. And all throughout this, a ton of education, again, personalized to you. And yes, it does make a difference. So what Tuned tries to do is create a personalized prevention and intervention plan for hearing loss prevention. Frequently asked question number 3 is, does Tuned also handle prescription hearing aids? And what does that look like? The answer, of course, is yes. Hearing aids are an important part of any audiologic model, and we do offer prescription hearing aids. After you've gone through Tune's sign-up process and our very comprehensive screening, there is a triage component. Not everyone is ready to move on to hearing aids if there might be an underlying medical condition. So after all of that takes place and referrals take place, you're then referred to our prescription hearing aid provider, and you will receive ongoing remote care. We like to ensure that hearing aid users don't just receive a device, but continued support for hearing function, cognitive function, emotional function, and workplace well-being. And finally, the 4th frequently asked question is, do I need Tuned when I can purchase an over-the-counter device from a store? This is a great question, as over-the-counter hearing aids are becoming very popular and can be accessed online or at big box stores. Over-the-counter hearing aids primarily address mild to moderate hearing loss. And unfortunately, when you just go and buy something at the store, individuals who need further care can be missed. What we do with over-the-counter devices through Tuned is we integrate prevention. Yes, even when you have hearing loss, prevention needs to be considered. Early detection and intervention and management. So while over-the-counter devices do attempt to solve an issue, which is you might need more sound brought into your ears, we build an entire framework to ensure a very holistic experience for your hearing so that nothing is missed along the way. Thank you for listening.